Welcome to EM Supply Room Series, Lumbar Puncture. For this LP, we will have the patient in the upright sitting position. For optimal positioning, have the patient place their feet on a step stool and lay their arms on a table. Have the patient arch their back and flex their hip to open the space between the spinous processes. Find your landmarks by placing your hands on the posterior iliac crest and feel for your landmark between L3 to L4 and L4 to L5 interspace. Mark the space with a skin marker or indenting the skin with a needle cap. Then apply cleaning solution like betadine or chlorhexidine scrub using a circular motion. To don your sterile gown, open the package. Insert your hands and arms into the envelopes on the lateral side of the folded gown while simultaneously allowing the gown to open in front of you. Place your sterile gloves on and have an assistant help tie your gown together. Upon opening your LP kit, you will note supplies like a glass vial of lidocaine, 25 gauge needle for local anesthesia administration, 4 collection tubes, cleaning solution, manometer with 3-way stopcock, a sterile drape, and a spinal needle. First, draw up your lidocaine before the procedure and have it ready for local administration. Secondly, prepare your spinal needle. An optimal size spinal needle is a 3.5, 20, or 22 gauge needle, as larger gauges have been associated with post-LP headache and CSF leak. Lastly, prepare your collection tubes by placing them in the upright positioned and in numerical order from 1 through 4 for fluid collection. Apply cleaning solution supplied in the LP kit to your landmark once more before draping the patient. Then, place the sterile drape on the patient. Palpate your landmarks and mark once more where you are planning to insert the spinal needle with the needle cap. You are now ready to begin the LP. First, inject a subcutaneous wheel of lidocaine to the landmark. Then, insert the needle through the track that you are planning on placing your spinal needle through. Since the patient is sitting upright for the LP, insert the spinal needle with the bevel facing right or left, then insert the spinal needle like you are aiming towards the umbilicus. As you continue to advance the spinal needle, you will feel 2 pops as the needle penetrates through the spinous ligaments. When advancing the needle, check frequently if you are receiving spinal fluid by removing the stylet and looking for flow of CSF. If there is no CSF, reinsert the stylet, keep advancing, and continue to look for CSF. If you are not getting CSF, you can slowly remove the needle to the subcutaneous tissue, repalpate your landmarks, and reinsert. Once you see flow of CSF, collect a few mLs in each of the collection tubes in numerical order. Replace the stylet before removing the spinal needle, then remove the spinal needle, and place a Band-Aid at the insertion site. Be sure to walk your CSF collection tubes to the lab.